You're having issues down there and you don't know what's going on. Bacterial vaginosis, commonly known as BV, or yeast infections. How can you tell what's going on? This is what this video is about. Hi, my name is Charity. I'm a pharmacist. Today is all about determining what's going on down there. So the vagina, the flower, the little girl, contains a bacteria called lactobacillus. This lactobacillus is a good bacteria and it leads to the production of lactic acid, making vagina a very acidic place. Normal pH of around 4 to 4.5. A healthy vagina is cleansed daily through secretions. This can be ignited by a few different factors such as arousal, response to a in response to the menstrual cycle. But you can also have an increase in secretions if the vagina is unwell. Discharge alone doesn't mean that something is going on with the flower, but it can. You also want to consider the color and the smell with the symptoms and the discharge. First about BV. Now, if you're having BV, one hallmark of bacterial vaginosis is the odor. A fishy, foul smell, especially after intercourse. This is like a hallmark of BV. Discharge is typically going to be colored anywhere from a gray to a tan type of tinge. So you're going to have increased secretions, which we're going to call discharge, and that discharge is going to be colored gray or tan. Now, your irritation in the vaginal area is going to be limited, so we're not having a lot of irritation going on. Discharge is going to be foul, but in terms of irritation, that's limited. Is that you're having a disruption in your normal flora. Lactobacillus, remember I said at the beginning, your vagina contains lactobacillus, and this lactobacillus leads to lactic acid, which makes the vagina be acidic. You're going to have a decrease in lactobacillus. That means your pH is probably going to be a little bit higher, so above that 4.5 pH, because the typical pH of the vagina is 4 to 4.5. A lot of women can notice that this tends to happen for them when they have a new partner. Typically, treating BV is going to require a prescription. You're going to have to go be seen by a provider, and you're going to need a prescription. They're likely going to give you a course of metronidazole. Metronidazole is they don't consider it an antibacterial. They call it an anti-infective. Patients normally take the tablets twice daily. These are the tablets, if you've ever taken before, you can't drink. They advise against drinking alcohol during the duration of the therapy up to at least 24 to 48 hours after you finish the therapy, because it can cause projectile vomiting. But some patients say that they can take metronidazole, and they've taken metronidazole and they haven't had any sort of projectile vomiting. I don't say that you test it out, but certainly if it, happens, I guess it happens. Also, what's good to know is that if you do happen to take the metronidazole, patients have noticed that even the alcohol from their mouthwash has been enough to cause some vomiting for them. It's just a little caveat or something to be on the lookout for. Yeast infections. I think the hallmark of yeast infections is itching. The same way the hallmark of BV is the foul odor, the fishy smell, typically after sex. The hallmark of yeast infections is typically itching. Patients will have discomfort, itching. That's all I got. Lots and lots and lots of it. Discharge, however, patients notice that the discharge when they have a yeast infection is thick, kind of like cottage cheese. They do have the vaginal irritation and redness, and this is likely due to the itching that patients experience. The pH of the vagina is between 4 and 4.5. We said that with BV, you lack lactobacillus, so your pH is higher. It's more basic, so you're looking for a pH higher than 4.5. Now, with yeast infections, your pH is typically more acidic than 4 when you have, when you have a yeast infection. The cause is really unknown. Yeast infections can be very, very broad. I remember having my very first yeast infection when I was pregnant with my daughter, and that happened to me right before I tested for gestational diabetes. So oftentimes recurrent yeast infections are indicative of the patient being a diabetic. So you want to be on top of that, especially if you have recurrent yeast infections. The other thing is, and it's not very common, but it does happen, and I've seen it in a lot of very, very resistant cases of recurrent yeast infections, where the female has a yeast infection. She has intercourse with the male. The male then gets a yeast infection. The female is treated, but the male keeps giving it back to her because the man does not present with symptoms of a yeast infection because of the anatomy of the penis. So or the male sleeps with someone who has a yeast infection and then gives that yeast infection to the female. She goes to get treated. Again, the male doesn't have any symptoms, but he keeps introducing the yeast infection to the female. And so to happen there is that the man will then need to be treated for a yeast infection. Typically, you can get a fluconazole. It's a one-time tablet, 150 milligrams. Normally you can take and it'll wipe it out. But sometimes patients will do a 150 milligram tablet and then 3 days or 7 days later, it just depends. If symptoms don't resolve, they'll do another 150 milligram tablet. And that is by prescription only. Now, medications also can cause patients or females to have yeast infections, such as antibiotics. So a lot of times if the doctor is prescribing you an antibiotic, they will go ahead and prescribe a fluconazole for preventative treatment, because we know that antibiotics don't differentiate between the good bacteria and the bad bacteria. They just take out all bacteria. So they will also prescribe you a fluconazole with your antibiotic. And then any other medication, well, not any other, but certain medications that will suppress the immune system can also cause a female to end up with a yeast infection. So we have the prescriptions for treatment, which I said was a fluconazole, but you also have some over-the-counter options. They have like the Monistat, 1 day, 3 day, 7 day. I say, and I've always said for as long as I've been practicing, my advice to ladies, if they come in with a yeast infection, is to get the Monistat 7 day. I personally don't feel like the 1 or 3 days is enough to take care of the issue. So a lot of times females will purchase that and they'll take it, and then day 3 is over and they're still having symptoms. I think it's better to get the 7 day, do it for the entire 7 days and then be done with it. So that's my advice with that. Whether you go with the Monistat or whatever you decide, let that be the 7 day course. I think it's better to use the cream at night. So I always advise ladies to use it at night, so that way they are inserting it and then they're laying down, and then in the morning they'll wash and bath and things like that. So this is the way that you can determine whether or not what's kind of a guide as to leading you towards whether you have BV or you have a yeast infection. I think it's good to purchase some pH strips, and I know I've seen them in places like CVS, Walgreens. Over in the feminine health area, they will have pH strips, and so that way you can test the pH of the vagina, and that's really going to help you determine what you kind of have. Now, this is not all inclusive, and this is not the end all be all. Certainly, not all patients exactly fall into these buckets, but it is a very good guide to helping you decide what's going on, if you have something going on down there. It's most common. I hope this video has been helpful for you. If you have any questions, please feel free to leave them below. I will try to answer them as I see them. And as always, until next time, bye.